Diana Vera, and I will be demonstrating vital signs and a full head-to-toe assessment. So I will start by knocking at my patient's door. Once allowed to come in, I will enter and I will close the door behind me to provide privacy. Once in the patient's room, I will perform hand hygiene. So I will put it all around. Okay. So once I have done that, I will introduce myself to my patient and explain what I will be doing today. Good morning, my name is Diana, and I would like to know if it's okay if I check your vitals and do a full head-to-toe assessment. The patient then tells me it's okay. So I will then ask him if he could give me his full name and date of birth. I will check his wristband. He tells me Teddy, January 1st, 1990. So everything matches, it's the correct patient. I will then ask him if he is allergic to latex. He tells me no, so I will then put on my gloves. After I have put on my gloves, I will check my surroundings. I will see that my patient has an IV on his left upper arm. I will check the IV bag and check the rate. I will check my surroundings and make sure that we are safe, that there's nothing in the way. I will then ask the patient if he is comfortable, if he needs to be adjusted, if everything's okay. He says yes, he's fine. I then raise the bed to an appropriate height level, and then I will start my vitals. So I will start by checking his temperature. So I will grab the thermometer and I will put the appropriate probe. I put the probe. Mr. Teddy, I'll be checking your temperature. Could you please open your mouth and raise your tongue? I will then put the probe in his mouth under his tongue. 98.6, that is normal. I will then dispose of the probe. I will then turn off the thermometer and put it onto the side. After that, I will be checking the patient's radial pulses. So I will locate his radial pulse. I will lay his arm across his abdomen, and I will feel his pulse for 30 seconds if his pulse is regular. If his pulse feels abnormal, I will feel for a full minute. If it is normal, I will just multiply that number by 2. And then after I have done that, I will also check his respirations. So when I'm observing him breathing, if I see that he is breathing normally and nothing abnormal, I will count for the 30, I will see for the 30 seconds, count his respirations, and multiply it by 2. But if I see that it is abnormal, I will count for the full minute. I will count his respirations for a full minute. And I will do this after each other because we don't want to let them know that we are checking their respirations, because they tend to alter their respirations. So once I have completed that, I will then check the patient's blood pressure. So I will grab my cuff, and when we are checking their blood pressure, we want to make sure we use the appropriate blood pressure cuff. We don't want the cuff to be too small or too big, because that can give us a false reading. And we also want to make sure that the artery line is lined up with the artery. So we would also check we would also ask the patient what their average blood pressure reading is, and if he was to tell us his blood pressure reading usually is 120/80, we would make sure to add 30 more to the systolic. So I would inflate the cuff all the way up to 150. And when doing so, what we will be recording is the first sound and the last sound. The first sound being the systolic and the last sound being the dystolic. So I will put this here at his artery. I will then put this here. I will inflate all the way up to 150. So once at 150, we will start deflating. The first sound will be your systolic, and your last sound will be the diastolic. So 126 over 82, and that's around his range that he gave us. So I will then put this to the side. And now I will ask him if he is in any pain. Mr. Teddy, do you have any pain right now? He tells me he's not in pain. But if the patient was to tell me that he was in pain, I would ask him between the scale of 1 to 10 what his pain level was. 1 being little pain and 10 being the most excruciating pain he has ever felt. And if he was to tell me he was in pain, I would make sure that I would check and see if he had the appropriate medication and advocate for my patient to have the right medication for his pain. So after that, I would check his pulse ox. I would use the pulse oximeter. And Mr. Teddy, I'm going to check your pulse oxygen. Put it on his finger. While checking his pulse oxygen, we will see that the meter also has his heart rate and for his pulse. And what we would do is compare the one from the meter, the machine, with the radial pulses that we had checked. So everything seems normal. We are done with that. Now we would compare his blood pressure with his previous vital signs and make sure that everything's in the range that it should be. We would then document per hospital protocol what his vitals were. After that, we will start our assessment. We will ask our patient, how are you feeling? What brought you into the hospital today? And we would then check his surroundings, asking him if he's okay, comfortable. So once completed with that, we will then start our assessment, his skin assessment. His skin, his hair, and his nails. So I would check his skin for any edema, any irritation, checking all of his bony areas, the temperature. I would then check the patient's scalp for the skin, the hair texture, any infestation. I would then check the patient's nails, doing the blanch test for the capillary refill. So everything seems fine. I would then do the skull assessment, face assessment, eyes, nose, ears, and mouth assessment. So I would start by asking the patient if he could raise his eyebrows for me, if he could smile for me. We want to see everything symmetrical. I would then let him know that I will be checking his pupillary size. So Mr. Teddy, I will be flashing a light into your eyes. Have you had any recent blurred vision, any headaches, anything bothering you? Okay. So then right now I would also check his mouth for any skin sores, any mouth sores, anything like that, checking anything out of the ordinary. I would then check his ears, ear canal, making sure everything's fine, his nares. Everything seems normal. So then I would start my neck, thorax, and lungs assessment. So I would start by asking him to do a range of motion of his arms. Is he having any stiffness, any uncomfortable pain while moving them? And then I would auscultate his posterior and anterior chest. So I would start by listening to his right upper lobe, left upper lobe, left lower lobe, right lower lobe, and asking him if he has any coughing, any if he's coughing up anything, any phlegm, the color of it, the amount of it, anything like that. And then after that, we would assess his heart and vessels. So when doing that, we would raise the gown and we would check all of his abdomen, any previous surgical incisions, any piercings, any skin, any tattoos, anything like that, any skin art. And after that, we would locate the apical pulse, which is located in the mid-clavicular fifth intercostal. Right. So we will listen for a full minute. So everything seems fine. So then we would palpate and auscultate the carotid artery, and we don't do them at the same time. And then we will also observe the jugular vein in case of any distension. So everything seems fine. I will then palpate the radial pulses and assess the bilateral hand grasps. Sorry. So everything seems fine. I would then assess the abdomen. So when assessing the abdomen, I would auscultate the abdomen. So I would listen to the right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. And after doing that, I would then percuss the quadrants. So with these two fingers, I will hit my knuckle area. So right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. And then after that, I will lightly palpate the quadrants. So while doing this, all four quadrants, I will ask my patient if he's having any abdomen pain, any nausea, any tenderness while I'm doing that. He says no, everything is fine. We would also check if Mr. Teddy had a Foley. He does not have a Foley, but if he did have a Foley, we would make sure to ask the patient if he has noticed any changes in the urine, any color, smell, anything like that. So then after completing that, we would do the musculoskeletal assessment. So I would ask him to do a range of motion of his legs, if he has any pain, any knee pain, joint pains, anything like that. And if everything seems fine while doing that, I will then palpate the bilateral pedal pulses. So that also seems fine. Everything's good. He says he's having no pain, nothing like that on his legs. So after that, that would finalize my assessment. I would then remove my gloves, and then I would dispose of my gloves. I would then perform hand hygiene again. Hand hygiene. Make sure we get all the areas. So then after I have done this, I will then ask my patient some questions. I would make sure if anybody was in the room, if he was okay with me asking these questions in front of them. Right now there's nobody here. So I would say, Mr. Teddy, how are you doing? I wanted to ask you if at home you feel safe. Is your environment safe? Is there anything else that I can help you with? Is there a need that has not been met? He says everything is fine. I then let him know that I will be returning in the next 30 minutes. But I will give him the call light and let him know that if you need anything else prior to that, you can always call and ask for me, and I can come and help you. So I will then lower the bed to the lowest level to provide the patient safety to reduce falls. I will give him his caller. I will say, if you need anything, call us. Don't do anything. Don't get out of bed without calling us so we can help you. Um, I will then leave the room, open the door, leave the room. I will then go and document everything that I have observed, seen, and done with the patient, appropriate with the hospital protocol. So that will conclude my vital signs and my full head to toe assessment on my patient Teddy. So yeah, thank you.